Hey, what's up, YouTube? Um, just making this video just for people that's basically going through the same thing that I went through, having the same questions and not getting too many answers about a lumbar surgery, injury. Um, December 2011, I injured my back, my lumbar L5S1. I had a L4, L5. Um, Injury also. It's a tear in one of the discs. I had a herniation in my L5S1. I had two epidural steroid injections. The first one gave relief uh, for two weeks. Second one gave relief for 2 days, basically. And it got worse. The pain came back worse than it was. I had an MRI done. Went to talk to the surgeon. Uh, he said he was going to do a discectomy, and I had that done on May 4th of 2012. Um, Automatically felt relief. Um, I could feel it when I was laying in my hospital bed. It's usually an outpatient kind of thing. I had to stay a day because I couldn't move at all. It was hurting. It's real painful. Well, for me, they said people's different. So it's usually outpatient. Within a couple hours, you're gonna be out the hospital. Like I said, I stayed a day in there. I had 13 staples in my back. The scar was maybe 2.5 inches long. Um, I say up to 3 months. 2 months. I felt a re-injury. I was laying in bed and I felt it just hit me hard. I was scared. I called the doctor the next day. He said it was normal. I told him all the symptoms I'm having: the numbness, the pain, the tingling, the shooting down the leg, um, pain in my foot, numbness in the heel of my foot on my left side. Everything's on my left side. He said it was not. He said it was normal. Um, I got released full duty. They took me off my meds. Um, no restrictions, nothing. I went back to work. Um, and it was hard. I had to walk around all day. I'm a welder. I had to do a lot of stuff that I know I couldn't do. Um, Immediately, I started complaining about it, and because the pain, it just kicked my butt. Um, I got back on restriction, and I was going through physical therapy. They gave me physical therapy again. It's a workers' comp case, so they approved physical therapy. They put me back on medication. Um, I had an MRI done just in the beginning of this month, which is August. I had like on the first or the second, something like that. It shows I seen it. I put it in my computer and I seen it first because I know how it looks. Um, and I see something wrong in there. So the report said the disc came back in my L5S1. Um, Hopefully pretty soon. I think on the 16th I'm gonna be talking to my surgeon again. And I'm contemplating. I don't know if they. I never heard of nobody getting two discectomies on the same disc. Uh, but I'm more than likely gonna think they're gonna try to throw fusion at me. Um, and if you can, you could Google it. You could YouTube it and look up the videos they have about fusions. It's a 10-year thing. Uh, you have to go back after 10 years. But I read up on it, and there's a lot of people that say it's a big change in their life for the good um, after the injury. Right now, I have a constant pain level out of 1 to 10, 10 being the worst imaginable pain. I have a constant pain level of 3, 4. Right now, I'm on pain meds. They have me on morphine, the KD and 10 milligram. They got me on Norco 10 325s, and they also have me on a new morphine sulfate, 15 milligram. I'm not real big on the pain meds, and I'll take one. Like right now, I just took one maybe 30 minutes ago, and I'm feeling all right. Yesterday I took one and had me feeling good and sleepy, and I woke up and I felt a headache, like a hangover. But they're all right. Well, if you have any questions, man, about anything, even what I've been through already in the past, like I said, I had not all in order, but I had 3 epidural steroid injections, lumbar left side, back. I had a L5S1 discectomy, and I'm contemplating on getting another discectomy or a fusion. Um, so I have been out of work for a little while now. They can't accommodate my restrictions at my job. Since I'm a welder, I can't do all that stretching and bending and doing all that stuff that welders do. But if you have any questions, if you're contemplating any kind of surgery, if you haven't had surgery yet, look into it. Google uh, whatever you're gonna have, a discectomy, a laminectomy. Google it, man. YouTube it. They have a lot of videos on here that help me. Anything I do, I YouTube it, man. If I'm not sure about it, I'm gonna YouTube it. And I YouTube diffusions, I YouTube discectomy, I YouTube epidural steroid. There's a lot of things, man. Just if you have any questions, and if I know them, I'll help you. It's no problem. I'll answer them. I'll answer them real quick. Uh, just just good luck with everything, and I will keep you posted on my progress. I'll try to video when I'm in the hospital and all that, so you'll get a pretty much idea. I think that's against the law to video while you're in the hospital, but I'll try to. I tell my wife to videotape it. Another thing, I'm gonna try, and I'm gonna have it posted on here for y'all, so y'all can check it out. Well, I'm out here, man. If y'all have any questions, man, just hit me up, and I'll get back with y'all, man. Again, I didn't put my age on here. I just turned 36, so uh, it's pretty young for fusions, but and just hit me up in the messages or the comments, man, and I'll try to answer all the questions that you have. Appreciate it.